estimated that nearly 90,000 people in our country will be diagnosed with a brain tumor this year alone. There are warning signs to look out for, and joining us now to explain more is Dr. Nazar Qureshi, the director of the Brain Tumor Program with Hartford Healthcare's Air Neuroscience Institute at the Hospital of Central Connecticut. Doctor, thanks so much for being with us today.
Thank you for having me.
People always worry about how would I know, but there are two categories of brain tumors. Can you explain what they are?
Sure. There is no other diagnosis in medical literature that creates a sense of fear and panic in somebody with a brain tumor. But let me tell you, not all brain tumors are created equal. There are brain tumors that are benign in nature, and sometimes they may not need any treatment at all, not even surgery. However, unfortunately, there are tumors that are malignant that do require treatment, and those can be further subdivided into primary brain tumors, the tumors that arise from the brain parenchyma itself, or the secondary ones, which are called metastatic brain tumors, which are the tumors that arose somewhere else in the body, such as lung and breast, and then they metastasize to the brain. This is a broad classification for the brain tumors. Brain tumors can happen anytime, and there are certain tumors that are common in children, and there are certain tumors that are common in adults, and they happen in 40s, 50s, 60s, 70s, or even beyond.
Okay, so in our minute that we have together, I know it's a lot to go over, but mainly, what are the symptoms that could indicate you might have a brain tumor?
Some symptoms are really out there that you cannot miss or ignore, such as somebody having a seizure for the first time, or not able to speak, or hold a conversation, or one side weaker than the other. But there are certain symptoms that are very vague, such as headache. You and I both know that all of us are entitled to have a headache sometime in our lifetime, based on what the life throws at you. But a headache that consistently happens in the morning when you have had a full night rest, that is a sign that you should go and see a physician. In addition to that, confusion, and sometimes the family members would have to pick it up as a person themselves might not know that their behavior is changing.
Right, so it's something to be aware of. And I know there's a lot of treatment options out there that would depend on the size of the tumor. We want to encourage people to get some more information by logging on to your Facebook, facebook.com/Hartford Healthcare, to join Dr. Qureshi in a live discussion right after this. I'm sure you might have more questions. And the doctor is in the house, so to speak. So, doctor, thanks for being with us and donating your time.